So, for those of you who don't know me, I'm Dr. Krystal Lynn Couture from the Pelvic Acu. We specialize in providing pelvic health education to acupuncturists so that acupuncturists can then specialize in pelvic care and bring this service to their clients. And I think we're really uniquely positioned as acupuncturists so that we are able to work with clients on the biomedical level with their physiology. We're also able to support them on the emotional level, and we're able to take their body through the patterns of healing in order to really start to repair and heal those patterns of dysfunction that we might see. So, welcome. I'm so glad that you're here, and I hope you enjoy this mini presentation on pelvic organ prolapse. So first off, commonly you're going to see pelvic organ prolapse referred to as POP for short. So if you see that on social media, now you'll know what it's all about. So what is a pelvic organ prolapse? Well, it's defined as the experience of one or more of the organs falling from their normal anatomical position into the vaginal wall, which often causes a bulge in that anatomical wall of the vagina. Now, causes of this can go kind of all over the place, but generally speaking, it's because there's some weakening of the pelvic floor muscles and loosening of the pelvic muscles, tendons, and the fascia as well, because we have that fascial network that's really important to consider here. Now, there can also be pelvic organ prolapse due to trauma. So, any kind of trauma that could occur perhaps during the birth process. Also, if there's a history of sexual abuse or a fall or anything like that, can also really impact those pelvic organs and how they're situated and mapped in the pelvis. Now, often pregnancy, labor and delivery, excessive straining for bowel movements, extended periods of coughing, and menopause. Those are the biggest components that can lead to weakening and loosening of that pelvic floor structure, that hammock-like structure. During their lifespan, 50% of women develop some type of pelvic organ prolapse, which is a pretty high number. Now, of course, symptoms and severity increase across the menopausal transition. And once one has a prolapse, it doesn't mean that they have to live with this prolapse forever, because there are alternatives that we can actually help provide, as well as other providers that can serve to provide. And of course, the biggest one is lifestyle modifications that the client can make. So improvements in prolapse can be made. So it's like, if I have a prolapse after I've had my baby, is this what I have to live with? And not necessarily is the answer. And I think that's important for us to remember. But these are some big numbers and I think important things to consider. So let's talk about pelvic organ prolapse and quality of life. So according to a study that was done in 2023, 57.5% of people reported overall poor quality of life due to their prolapse. 73.6% said that this prolapse impacted their personal relationships. 24.2% said that their sleep and their energy were impacted because of their prolapse. And the study also found that there were significant correlations between quality of life and other conditions. And in particular, stage 3 or 4 prolapse, which we'll talk about, menopause, unmarried women, which were widowed or divorced, which I thought was interesting, as well as longer duration prolapse had higher correlations with that poor quality of life association. Now, symptoms of a pelvic organ prolapse. Okay, so the first thing we need to remember is that sometimes a client may not know that they have a pelvic organ prolapse. They may be asymptomatic. They may not have felt a bulge. They may not have experienced any other symptoms, or they may not know that the symptoms they are experiencing are correlated with the prolapse, right? So it's important for us to know about that and be aware of these signs and symptoms, and also the red flags, which we're going to go over in just a few minutes, to really help us to support our clients and get them referred out if they need to be referred out to be seen by a physician to be diagnosed with a prolapse, and then, given information on where to go from there. So the first most common symptom that someone knows they have a prolapse is because they see or they feel a bulge of tissue at or beyond the opening of the vagina. Next, pelvic pressure, heaviness, or pain. And they may say this is something like, this is going to sound really weird, Dr. Krystal, but I have like this pressure and heaviness in my pelvis that I never had before. And sometimes it's a little bit painful. Mostly it's just this heaviness. And I know that sounds really weird. Well, in our heads as practitioners, that's a great time for us to be thinking about possibility of prolapse. Low back pain is common with prolapse. Inability to hold in a tampon, a menstrual cup, a disc, a diaphragm, any of those things are also signs of prolapse. Urinary changes, which could be the spectrum, right? They could be frequency, urgency, retention, and a weak urine stream. There can be bowel changes as well. So frequency, urgency, retention. And then the client may say that they are splinting. And honestly, the first time I heard about splinting was from a client. I didn't know about it as a thing. This was years and years ago. I didn't know about it as a thing. And the client said, in order to have a complete bowel movement, I have to insert my finger into my vagina and press against the back wall of the vagina in order to have a complete bowel movement. And I was like, oh, wait, I think we've probably got a rectal prolapse here. And sure enough, they did. So the client knew that they were doing this and they didn't know why they had to do this. So client education is really, really important. So they may tell you that they're splinting by inserting a finger into the vagina in order to have a bowel movement. And that's a really indicative sign of a pelvic organ prolapse. Usually it's the rectum, could also be the small bowel. And painful intercourse is another symptom of a pelvic organ prolapse. Now, of course, painful intercourse, urinary changes, bowel changes, low back pain, these can all be related to other things besides pelvic organ prolapse, but it's important to keep in our mind as we start to unfold a history with a client. So let's very briefly go into very basic anatomy that we see. Okay, so this is the normal anatomy of a woman, someone who's identifying as female or assigned female as birth. So we can see on the right side of your screen, you can see this little gray circle right here. That's the pubic bone. So then next to the pubic bone, so we're going from anterior to posterior, right to left of the screen. So we have the pubic bone, then we have the bladder, okay? Then we have the uterus connecting into the vagina, and then we have the rectum. So as we can see here, everything is supple, everything is tonified, it's holding itself up in space. What we can't see are the pelvic floor muscles, and we also can't see the fascial structures here. We don't see the remainder of the intestines, but we can imagine that those are all there. And of course, on the farthest left, we have the sacrum, right? So that's our normal anatomy. Now, if we look at types of prolapse, we're going to look at the most common, the three most common, and then we'll talk very briefly about the others. So the first type of prolapse is a cystocele, which is a prolapse of the bladder. Now, you can see here in this image, again, same thing, right to left, pubic bone, all the way to sacrum. We've got the bladder that has descended down. So the bladder has dropped from being just anterior to the uterus to just anterior and inferior, which means it's encroaching upon the vagina. So the definition is the bladder bulging into the vaginal wall. Our most common symptoms here are going to be urinary leakage, pressure, and incomplete emptying or urine retention. The Western causes of this, are very often going to be childbirth, chronic coughing, and of course, aging, which tends to be a common cause when we go from the Western perspective, right? So in the TCM view, what we really often see here is we see a spleen Qi deficiency to a spleen Qi sinking, and we can also have a kidney Qi deficiency as well. So let's not rule out kidney Qi deficiency when we're talking about prolapses. Now, a rectocele, okay? So here, if we look at our image, once again, right to left, we're going from pubic bone to sacrum. So the bladder is in its proper position, the uterus is in its proper position, but the colon has dropped down. And you can see where the external anal sphincter is, and then where the colon is bulging out into the vagina, right? There's definitely an opportunity for waste to get stuck there and for that to be pretty uncomfortable for people. So, a prolapse of the rectum is called a rectocele. The definition is that the rectum bulges into the posterior vaginal wall. Symptoms here most likely are going to involve the bowel. So we may have incomplete bowel movements, the bulging sensation. It may feel really heavy down there. We also may see, from a clinical perspective, we may see more hemorrhoids, we may see more irritation around the external anal sphincter, and they may have some irritation going up into the colon as well. Some of the contributing factors here often are going to be constipation, straining, and then again, this fascial weakening. The TCM patterns here, once again, we are going to see spleen chi sinking, spleen chi deficiency, that kind of stuff can really show up for us. But we can also have chi stagnation, right? Because the colon is a place of elimination. If we're not eliminating, then it's very possible that we could have stagnation. Stagnation, as we know in TCM, is the proponent for all disease. So now the third most common type of prolapse that we're going to see is a uterine prolapse, okay? This one doesn't have a fancy name. It's just known as uterine prolapse. The definition here is that the uterus drops down through the vagina, okay? So we see the colon here is exactly how it's meant to be. The bladder is exactly how it's meant to be, but the uterus has dropped down. It often drops posterior and inferior. So we see that sort of drop, and then it comes down through the vagina. Now, uterine prolapses are graded in severity from 1 to 4. We're going to talk about that in just a moment. Symptoms here that we see most commonly are going to be pelvic pressure. The cervix may actually be visible, through the opening of the vagina. We may have a lower back ache with this. Now, the Western view here is that we have some ligamentous laxity, and there's poor pelvic support, and those pelvic floor muscles are weak. Now, we can see that the area is really small, right? Between the pubic bone and the tip of the coccyx, this is a small area of real estate that we are talking about. So these pelvic floor muscles that we have, these 6 primary pelvic floor muscles, are kind of going to impact the totality of the pelvic floor. And these organs are going to be impacted by each other as well. From a TCM pattern here, we can see actually Yin-Yang deficiency. So Qi deficiency becomes Yin-Yang deficiency. And also, I see very commonly that there's Chong and Ren disharmony. So that can be part of it as well. And of course, your spleen Qi deficiency, your Qi deficiency is going to show up as well. Now, our stages of uterine prolapse, okay? Stage 1 is that the uterus has dropped into the upper half of the vagina. Someone may not know they have a uterine prolapse at this stage. Stage 2, the uterus has descended nearly to the opening of the vagina. So the chances are at this point, they're going to be aware, especially if they're having some type of intercourse or insertion of a tampon or something of that sort, right? They're going to know that something might be a little bit off here. Stage 3 is that the uterus protrudes outside of the vagina. And stage 4 is that the uterus has completely descended from the vagina. So those are the stages of the uterine prolapse. Now, we're not going to be, in our practices, we're not going to be staging prolapses, but it is important for us to know what's happening and for us to be able to have these conversations with other providers and also with our clients, because they may be seeing hopefully other providers as well. So we've got other types of prolapses as well. They're a little bit less common, but still important to know. So a urethrocoele, we can posit that urethrocoele means the urethra, right? So the urethra sinks into the anterior wall of the vagina. This can lead to incontinence, frequent or urgent urination, and it can also have some like burning sensation to it, like almost like a little bit of a UTI-ish symptom, just because there's not space there. The urethra is small, it's being compressed. We can also have both the bladder prolapse and the urethra prolapse together. So that's a cystourethroceal. A vaginal vault prolapse. This is common for those who've gone through a hysterectomy. And this is when the top part of the vaginal wall, so the vault, droops down towards the vaginal canal. And like I said, most common after hysterectomy because we don't have a uterus in place, right? Nothing is holding the vaginal vault up. Enteroceal is when the small intestine prolapses into the superior posterior wall of the vagina. And then we can also have a perineal prolapse where the perineum sinks down below its normal place on the pelvis. And this one is actually often due to trauma, which trauma can be birth trauma as well. So what are the diagnostics here? Well, the diagnostics that are usually used with a gynecologist, OB, etc. First off, a pelvic exam, of course. And then oftentimes they do a dynamic pelvic MRI, which provides like a detailed topography of the organs. Furthermore, they can do some urodynamic testing to evaluate bladder function, which can be really important to get information and insight. And finally, CTs and ultrasounds can be used to rule out other conditions. These are less common, but in super complex cases, I have seen those used as well. So red flags, right? When is a referral needed? The keys here are going to be super important. Urine retention. If there is an inability to empty the bladder, okay, this can lead to UTIs and kidney problems and a lot of things down the road. Urine retention is nothing to mess around with, right? Everything has been filtered through the system and we want it to exit the system. If it's not exiting the system and that waste is staying in the system, that can be really, really toxic. So if our client is in the place where they're coming in and they know they're retaining urine, and very often they do, they really should be referred out. Vaginal erosions are another one. So erosions on the tissue of the vagina or on the cervix can be really, really serious and require special care, especially when combined with a prolapse. This is just kind of a mess waiting to happen. So we want to make sure that we're able to refer out in those situations. Stage 3 or stage 4 prolapse, if these clients are not being followed by a provider, they really need to be at this point because their internal organs are outside of their body. And when the internal meets the external, that's another space for things to kind of really get in trouble. And they may need to have some type of medical intervention in order to support that so that their body can stay in proper functioning level, right? Because once the organs are outside of the body, then we can start to have a whole other host of problems, not even to mention infection. So that's important to consider. So speaking of interventions, from a Western perspective, the predominant interventions are surgery. Pessaries are becoming more common because they're actually evolving, which is great. I love to see them evolving because they can really help with quality of life, especially when there is independence with them. And I love that pessaries can be used concomitantly with either what PT is doing or what acupuncture is doing to support the body and allow the body a chance to heal before jumping to surgery. And then, of course, we have pelvic floor PT. Pelvic floor PT commonly works with exercises, and they also work with breathing. And very often they also work with biofeedback. So helping to provide information through the pelvic floor muscles as to whether they're contracting or relaxing so that the client is able to build more awareness. As far as acupuncture goes, there are pattern treatments that we can do. So getting into the spleen qi, the kidney yang, qi stagnation, we can certainly help with those things. We can use the extraordinary vessels to harmonize the Chang, the Ren, the Dai, whatever we might find there, but the extraordinaries are a great way in to help us with prolapses, since the extraordinaries really have deep connections to these organs, right? And to the womb. And going back to the being in the womb themselves, right? So I love working with that. And Spirit of the Points is really helpful too. This is so emotional. So using a 5-element approach or an esoteric approach, whatever you might be into from kind of that spirit perspective, can be very valid, because quality of life is severely impacted. When quality of life is impacted, that means the emotions are impacted. That means the nervous system is impacted. That means this person is just having a hard go at feeling activated and present and able to function within this body in this life. So I love being able to, impart this as part of what we do. And very often with my clients with prolapse, I'm using patterns, I'm using extraordinary vessels, I'm using Spirit of the Points, and I'm also using, a biomedical approach as far as working deeply into the pelvic floor musculature. Now, this is obviously beyond the scope of this practice, this 20-minute course to talk about pelvic floor acupuncture and how we might do that. But if you've taken one of my classes, it can be very helpful, especially when you're combining it with these other layers of treatment that are part of what you're already doing. So concomitant treatments, right? We have a lot of tools in the toolbox that are not things that we might do every single time in the treatment, but they're things that clients can do on their own. And so moxa, direct moxa, a moxa box on the abdomen, toilet bowl moxa, these can all be, if there's not a heat contraindication, these can all be really nice ways to help to lift and consolidate energy, and also provide some chi where we have deficiencies. I love instructing clients in abdominal massage, and I'm really basic with abdominal massage. I like to teach them to go up the ascending colon, across the transverse colon, and down the descending colon, right? Just creating that upside down U pattern is very helpful. I also like to have them put, both thumbs into the belly button and then massage with the fingers onto the ovaries if they still have ovaries. That can be really nice. For our pregnant clients, or postpartum clients, I love to encourage perineal massage. I think that is a great way to support clients as well. You may love qigong. That might be something that you love to teach, you love to share. You might have videos online. So this is another great way to bring in some support from that spiritual emotional level, and just getting your clients on board with their alignment. I think one thing we always often forget is how much nutrition impacts what's happening in the body. So if we know that this person has yin yang deficiency, I always recommend, like, to practitioners, get yourself a list of like your yin yang deficiency foods, your yin yang deficiency foods, whatever it is that you see the most of in your practice. Get lists of these and give them out to your clients that need them, and tell them, have at least one of these foods with each meal. And that's a change that very often it's like, oh, I don't have to take anything away. You're not telling me to avoid certain things. And you may like give them a short list of avoids, but you're mostly having them add on to get some nourishment that they really need, right? And people tend to be really responsive to that. Chinese and Western herbs can be supportive here. Again, when you're looking at the pattern, when you're looking at where we need support, if you happen to have blood work, right? So great way to come in. Breath work is another thing. Your clients can do this at home. You can teach them the pelvic breath. I teach it in my free intro class. So if you haven't taken that yet, take that, learn the pelvic breath, teach it to all your clients. It's really transforming for pelvic health clients. Core and pelvic floor awareness, strengthening and stretching, that might be your thing. You might want to bring that in. And then finally, just educating your client, right? Giving them the knowledge that you have, helping them feel like they're not alone in this process, supporting them through is key. And it goes so far, because very often they come to us and they feel like they haven't been seen or heard at their primary office. All right, so a couple of studies here on the efficacy of acupuncture. So a 2021 study, this one's really interesting because it looked at a couple of things. It was looking at acupuncture in postpartum females. They were 8 weeks postpartum, and they were also looking at the transperineal pelvic floor ultrasound. So they were looking at the efficacy of acupuncture, and also was the transperineal pelvic floor ultrasound effective at determining changes. And what they found is that after acupuncture treatment, the bladder neck descent had decreased by an average of 3.8 centimeters, and the anal levator. So, what I think they mean by the anal levator is the of the levator ani muscles, there's the puborectalis muscle. And I'm guessing that's the one they mentioned. I didn't see a picture and it didn't have the actual puborectalis or, pubococcygeus or iliococcygeus listed, but I imagine that's what they meant. It decreased as well by 3.4 centimeters square compared to the control group. So, what that means is that there was a definite change and a definite reduction in kind of the laxity of the hammock, right? And so the hammock got a little bit of tighter and the bladder descent got a little bit more ascended. So I think these were really, really good. Also the levator, anal levator muscle hole diameter decreased as well. And the anterior posterior diameter decreased. So I think overall what this means is that there were improvements in the cystocele, which is the prolapse of the bladder, and uterine prolapse, which they were able to demonstrate in this study, which is pretty impressive, right? Essentially, they also found that the parameters of using the transperineal pelvic floor ultrasound can help to evaluate the therapy performance. Now, in this study, the clients were given 3 times a week, they were given pelvic floor exercises, which seemed to be very basic. They seemed to be a lift, contract, and relax, where they repeated that 10 times for 3 sets, if I remember correctly. So they were doing a pelvic floor exercise, but both the control group and the acupuncture group was receiving the exercises. Now, here's where things got really interesting in this group. So they did acupuncture points, they did moxa points, they did electroacupuncture points, and then after they did all this, they also did a CV1 retention for 30 minutes. So I found that really, really compelling. Because they kind of brought in multiple modalities here. So acupuncture points, common points of choice, right? That most of us might think of: CV12, stomach 25, CV4, CV6, and stomach 36. They did moxa on bladder 28 and bladder 23. I also did electroacupuncture on CV3 and stomach 28. And then, as I mentioned, the retention on CV1 for 30 minutes. We have another study, which was actually done in 2023, which is a meta-analysis. And this was acupuncture combined with pelvic floor rehab, once again, postpartum, for stress urinary incontinence. And what they found is that acupuncture combined with pelvic rehab can effectively promote the rehabilitation of postpartum stress urinary incontinence patients and provide a reference for clinical application of integrated Chinese and Western medicine treatment within the field of rehabilitation. So this was quite interesting. There were a lot of studies in this meta-analysis. And of course, there was electroacupuncture, there was acupuncture, there was moxa, there was basically the gamut of all things acupuncture. And so I think these are good studies. I think there's space definitely for more studies out there about acupuncture and prolapse. But I think this shows a great start. And these are modern studies. They're relatively recent, and there are new studies coming out that are not, their kind of outlines have been published and their methods have been published, but the results have not been published yet. So I'm really excited to see where those go, specifically one from 2022 related to various types of prolapse. So I'm excited to see where that goes. Now, looking through, references from acupuncturists throughout time, right? So looking at Machocha and Bob Floss, when we have spleen Qi deficiency and a prolapse, I think some important points for us to consider, right, are that CV12, stomach 36, spleen 6, bladder 20, CV6, CV3, bladder 22, bladder 28, and GV20. So we see a lot of repeat here between these points as well as the study. But I wanted to lay them out for you. These are some of the points that I consider most commonly. And then for kidney deficiency and prolapse, of course, bladder 23, kidney 7, bladder 28, CV3, bladder 22, once again, CV4, lung 7, and kidney 6, right, to get after the extraordinary vessels there, GV20, and of course, moxa on CV8. So that concludes our presentation portion of today. I have upcoming classes this fall. In September, I will be in Seattle. In October, I'm going to be in my neck of the woods, just 1 hour away in Biddeford, Maine. And in November, I will be in Phoenix, Arizona. Also on social media, I'm at the Pelvic Acu, and I also have a Facebook group, the Pelvic Acupuncture Collective. I would love, love, love to connect with you in any of those platforms. I'm just going to go ahead and share references here really quick. You can screenshot this if you like to. Otherwise, I'll stop my share and we'll open the floor.